Reproductive life planning includes all the decisions an individual or couple make about whether and when to have children, how many children, and how they are spaced.
Most women who bear children whose conception is unintended are adolescent. The woman may be less likely to breastfeed, seek prenatal care, and protect her fetus from harmful substances.
Take note that it is important for the health of children that pregnancy should be intended because if not, both short-term and long-term consequences can result.
These are the risk factors for unintended or mistimed pregnancies: low birth weight, death in the first year of life, and maltreatment and insufficient healthy resources for development.
Others want information on increasing fertility and about their ability to conceive. As a result of changing social values and lifestyle, many people today are able to talk easily about reproductive life planning. Other people, however, may be uncomfortable with this topic and may not voice their interest in the subject independently. For this reason, at health assessments, ask the clients if they want more information or need any help with reproductive life planning as part of obtaining a basic health history. Nursing diagnosis. Reproductive life planning touches so many facets of life. Nursing diagnosis can differ greatly depending on the circumstances and individual preferences. Example might include readiness for enhanced knowledge regarding contraception options related to a desire to prevent pregnancy. Deficient knowledge related to use of diaphragm. Spiritual distress related to partners' preferences for contraception. Decisional conflict regarding choice of birth control because of health concerns. Powerlessness related to failure of chosen contraceptives. Altered sexuality pattern related to fear of pregnancy. And lastly, risk for ineffective health maintenance related to lack of knowledge about natural family planning methods. When establishing expected outcomes for care in this area, be certain plans are realistic for each couple. For example, if a woman has a history of poor compliance with medication, for instance, it might not be realistic for her plan on taking an oral contraceptive every day. If she only desires temporary contraception, tubial ligation or vasectomy for her partner would certainly be inappropriate. Be certain when counseling to be sensitive to a couple's religious, cultural, and moral beliefs before suggesting possible methods. It is equally important to explore your own beliefs and values before counseling. This not only helps develop self-awareness of how these beliefs affect nursing care, but it also allows you to become more sensitive to the beliefs of others. Clients are required to provide information consent for surgical contraceptive methods or procedures such as vasectomy or tubal ligation. The risks, benefits, alternatives, and proper use of the method, and the client's understanding of his or her rights and responsibilities should be included in the consent form, as this helps to ensure clients have weighed their options and know that the procedure may be irreversible. If you are helping to obtain a consent signature, always do so in the presence of a witness. Outcome evaluation. Evaluation is important in reproductive life planning because anything that causes clients to discontinue or misuse a particular method will leave them at risk of pregnancy. Reassess early within 1 to 3 weeks after a couple begins a new method of contraception to prevent such an occurrence. Evaluate not only whether a chosen method is effective, but also whether a woman and her partner are satisfied or have further questions. Examples of expected outcomes include: client voices confidence in chosen contraceptive methods by next visit. Client expresses satisfaction with chosen method at follow-up visit. Client consistently uses chosen method without pregnancy for 1 year's time.
Contraception. As many as 93% of women in the United States of America, the childbearing age, use some form of contraception, CDC 2012. Major unintended adolescent pregnancy, the need for morning and after or postal medication, and elective termination of pregnancy, the CDC 2012.
Important things to consider when helping a couple choose a method that will be right for them. Personal values, ability to use a method correctly, if the method will affect sexual enjoyment, financial factors, if a couple's relationship is short-term or long-term, prior experiences with contraception, and lastly, future plans.
Understanding how various methods of contraception work and how they compare in terms of benefits and disadvantages is necessary for successful counseling. When counseling, in addition to assessing to determine a best contraceptive option, be given to a certain emphasis or safer sex. And then, although there are many contraceptive options for reliable provide protection and against sexually transmitted infection or STI or an HIV, important concern if a relationship is not a monogamous one. Consider each person's lifestyle and overall health as this influence what type of conception or contraceptive a woman will choose.
Assessing a woman for possible contraindications to contraceptive use. People differ greatly in the way they desire or accept information on reproductive life planning, depending on individual preferences and socio-cultural influences. For example, certain religions do not believe a method beyond abstinence or fertility awareness is right to use. People with lower incomes cannot afford surgical procedures or methods such as daily combination pills. Be certain while counseling in this area that you do not impose your own values on people, but rather work together to identify a system that your patient will be able to follow consistently.
Women from a male-dominant family may have a little choice as what reproductive life planning method they can choose. If their partner does not wish to participate in contraception planning, it would be inappropriate to suggest a type where male cooperation is needed, such as use of a female condom or natural family planning.
It is important to carefully answer a patient's question regarding methods of contraception, because no method of contraception except abstinence offers 100% protection against pregnancy. It is necessary to be prepared to answer questions about post-coital protection if there were unprotected sexual relations, as well as elective termination of pregnancy if contraception failed. Only when couples have sufficient information in all these areas and the freedom to discuss specific concerns can they be prepared to make a decision that will be right for them. An ideal contraceptive should be safe, effective, compatible with religious and cultural beliefs and personal preferences of both the user and sexual partner, free of bothersome side effects, convenient to use and easily obtainable, affordable and needing few instructions for effective use, free of effects after discontinuation and future pregnancies. Before patient begins using a new method of contraception, these are the information that should be obtained. Vital signs, possibly pap smear, pregnancy test, gonococcal and chlamydial screening, and perhaps hemoglobin for detection of anemia. Obstetric history, including STIs, past pregnancies, previous abortions, failure or previously used methods, and compliance history with previously used methods. Subjective assessment of client's desire, needs, feelings, and understanding of conception. Sexual practices such as frequency, number of partners, feeling about sex, and body image.
Natural family planning. According to Hanson and Burke, natural family planning methods, also called as periodic abstinence methods, are, as the name implies, methods that involve no introduction of chemical or foreign materials into the body. Many people hold religious belief that rule out the use of birth control pills or devices. Others simply believe a natural way of planning pregnancies that will involve no expense, does not introduce a foreign substance into their body, and has no risk to a fetus should they become pregnant is best for them. Abstinence. Abstinence or refraining from sexual relations has a theoretical 0% failure rate and is also the most effective way to prevent STIs client or sexually transmitted infection. However, particularly adolescents may find it difficult to adhere to abstinence because of peer pressure. In the moment of passion, many otherwise responsible people may completely overlook abstinence as an option. Because it is difficult for many women to adhere to abstinence, the method has a failure rate as high as 85%.
Amenorrhea method is a safe birth control method. A failure rate of about 1% to 5% if an infant is being totally breastfed at least every 4 hours driving a day and every 6 hours in night. Receives no supplement feeding and menses has not returned. After 6 months or if the infant begins to receive supplementary feedings or isn't sucking well, the use of lactation amenorrhea method as an effective birth control method becomes questionable and the woman probably should be advised to be choose and other method of contraception. The woman should also consider a different method of a contraception once her baby begins sleeping through the night, even if this occurs before the child reaching 6 months of age. Coitus interruptus withdrawals is one of the oldest known methods of contraception. The couple proceed with coitus until the movement of ejaculation. Then the man withdraws and spermatozoa are emitted outside the vagina.
Fertility awareness method. Fertility awareness methods rely on detecting when a woman will be capable of impregnation, which is the fertile, so she can use periods of abstinence during that time. There are a variety of ways to determine a fertile period, such as using a calendar to calculate the period of time based on the set formula such as cycle beds. Calendar rain method. The calendar method requires a couple to abstain from the coitus on the days of a menstrual cycle.
To calculate safe days, she subtracts 18 from the shortest cycle she documented. This number predicts her first fertile day. She then subtracts 11 from her longest cycle. This represents her last fertile day. If she had 6 menstrual cycles ranging from 25 to 29 days, her fertile period would be from the 7th day. To avoid pregnancy, she would avoid coitus during those days. When used conscientiously, the method has a low failure rate. In typical use, however, this rate rises substantially because of irregular menstrual cycles, miscalculations, or disregard for predicted fertile days.
Basal body temperature method. Just before the day of ovulation, a woman's basal body temperature about 0.5 Fahrenheit at the time of ovulation.
Her basal body temperature rises a full Fahrenheit degree or 0.2 degrees Celsius because of the rise in progesterone with ovulation. This pattern serves as the basis for the basal body temperature method of contraception. To use this method, the woman takes her temperature either orally or with a tympanic thermometer each morning immediately after waking before she rises from bed or undertakes any activities. This is her basal body temperature. A woman who works night should take her temperature after awakening from her longest sleep period, no matter what the time of the day.